Hey guys, so in today's video, I wanted to give you all a little bit of a health update. Later on this evening, I am actually going to get an MRI. So, for those of you who have followed me for a long time, I do have a few that have followed me since I was in my CNA training way back in 2016. Um, I actually hurt myself when I was working as a CNA at my very first CNA job. Um, I also hurt my back when I was working as a CNA on the trach unit, and the one nurse that usually worked over there would never help me when turning the trach patients. And if you guys didn't know, patients on a trach, in a very rare occasion, there are patients with a trach that are able to care for themselves and are not bound to the bed or bed bound. But in the trach unit or on the trach unit where I was working, almost everyone on that unit was bedbound and unable to care for themselves. And so, turning these patients, there was a few of them that were extremely overweight, and I ended up injuring my back really badly, and I have had ongoing back pain ever since. So I've been dealing with chronic back pain since 2016, 2017, somewhere around there. And I've just really been struggling with my back pain. So I finally asked my primary care doctor or primary care provider if he would put in an order for me to get a lower back MRI. So I am going to get that completed today. I did also have him put in an order for an x-ray of my neck, and um, I got that done a couple days ago, and that came back normal, which I think I'm going to ask him for either a CT scan or an MRI of my neck, just because I have a lot of chronic neck pain as well. So I've been dealing with chronic back pain as well as chronic neck pain. It may be due to like the hypermobility of my body, but I'm not really sure. I just like I have so many issues with pain right now that I need to figure out what exactly is going on. And I actually have a referral to a neurosurgeon, and they have been calling me to schedule, but I'm waiting until the MRI comes back, because if it doesn't really show anything, um, on the MRI, then it's kind of pointless for me to travel 4 hours to this neurosurgeon's office, because that is how long this neurosurgeon is from where I live. So, um, that's really one of the closest neurosurgeons, because the one that I previously had a referral to actually moved and is now practicing in a totally different area that's farther than 4 hours away. So I just need to get this pain under control somehow. So once I get this MRI completed today, then I will be able to call the neurosurgeon's office back and get an appointment scheduled with them and see, what they might be able to help with as far as my back pain. So, most of my back pain is lower, and on a previous CT scan, it had showed a mild form of spina bifida between L5 and S1. Um, this is of my lumbar. The MRI is of my lumbar back. So I'm not sure if it will show the issue with L5S1. I'm not sure if it will get down that far to show that. And so I'm hoping that it will show that, or that they will see some sort of issue that could be causing all of my chronic pain, so that they might be able to have a solution to my problems, because I really just need to get this taken care of, and it's difficult to deal with on a daily basis. I'm constantly like trying to move my back into different positions, and every time I move my back in a certain way, I hear like cracking and popping, and it feels painful. So I just really want to get that under control. Um, I am still doing, aside from that, I am still doing physical therapy and occupational therapy, even with my new job. However, I have had to cancel and move around certain appointments just because of, obviously, I have to work a certain schedule now that I have a job, even though it's part time. Um, like when I return to work, not next week, but the week after, I work from 10 to 5 every day except for Thursday, which I work 8 o'clock until the clinic is closed. So I have no idea how long I could be at work that day. It just depends on how many patients we have. Um, so if I get done early, like before my fiance gets off work, then I will be able to walk to the library, which is not far from where I work, and just kind of hang out there until he gets done with work. But because of that, like I said, I've had to move around different appointments that I had previously scheduled with physical and occupational therapy, which I'm going to have to talk to their scheduler because I was due for a reassessment on a day that I have to work. So I'm going to have to see if they can move that appointment around because I can't miss work. Obviously, I'm within my 90-day probationary period. So I do have to have good attendance and be punctual and things like that, obviously. Um, so I am still going to occupational and physical therapy. It is just not my only focus now because when I first got into the outpatient therapies, um, that was my priority. It was my main focus. And now I have that as well as my job because I just felt like I was not contributing enough to the household. And I felt like I needed a part time job or a full time job. But when I found this opportunity, I was very happy with finding a part time job that kind of worked with my school schedule as well as my therapy schedule because I am also a full time student. So I'm a part time employee, a full time student, and I also have to go to occupational and physical therapy to try to continue to rehabilitate myself um, and get back to a level of functioning where I feel comfortable living my life. There's just a lot going on, and I feel like I need to make certain things a priority, but also prioritize bringing things into the household financially because I have felt awful not contributing really anything financially for the last however many months. Um, so yeah, those are just kind of the things that are going on with me health wise. I did almost have a crisis with my seizure medications because Walmart was telling me it was too early to fill my medications, two of them, and those were the controlled substances. But I was completely out of both of them. So I was like, okay, I'm not sure how it's early because I am completely out of them. And so I should not be early to pick them up. So they were able to fix that issue and I was able to pick them up. So thankfully, I avoided not having my seizure medications. And as far as my seizure medications go, I just want to let you guys know that I have definitely had a decrease in seizures, breakthrough seizures, and issues like that since switching off of the Keppra. And now I'm on Vimpat slash lacosamide and Xcopri. I have definitely had a lot better seizure control while being on those medications and getting rid of the Keppra. My peripheral vision is also better. It has returned to basically completely normal. I still have a little bit of issues like this far back, which is way better than it was before I was able to stop the Keppra. So thankfully, coming off of the Keppra has definitely helped bring my peripheral vision back. And I am so thankful for that because when all of my peripheral vision issues were going on, I wasn't sure exactly what was going to help, if anything, and I wasn't sure what was going on. So thankfully, stopping that has helped me get back to normal as far as peripheral vision goes. So anyways, that is it for today's video. If you guys have any comments, questions, or suggestions on topics you would like to hear me talk about in the future, let me know and I will get something filmed for you. I hope you guys are having an awesome day and I will talk to you guys in tomorrow's video.